What's up guys, Holden here, H-Bomb Fitness. Today I want to talk about external and internal rotation of the hip. So when we're missing internal rotation of the hip, basically what happens is that it inhibits us to also fully externally rotate. So if we're missing internal rotation of the hip, that's limiting our factor to push and drive our knees out, because that internal rotation is tight, so we can't get the full sliding surface to push out. Also, internal rotation is very important just for knee mechanics, ACL tears and stuff. If we're missing internal rotation, we're basically extremely limited at the hip. And when you are missing internal rotation, a lot of hip impingement occurs, and a lot of other problems can occur in the pelvis, knees, back, even up to the shoulder, because that missing range of motion in the hip, which is a very large joint, movable joint, if we're missing that, we're basically eliminating a lot of our whole body range of motion, because our hips are our driving force. So if we're missing that range there, then a lot of other things can be inhibited. So for me personally, I've been dealing with some limited range of motion, internal range of motion, on my right side. So lately I've been trying to go after that, and you can tell. So here's the test you can do. You can basically, you take your leg, and external rotation of the hip is like that, internal rotation is that way. Obviously everyone always is going to have more external rotation. That's just how the human body is built. We can externally rotate more, but internal rotation is usually not as great, but you should have a sufficient amount. Like right about here, I could even go a little more. So this is what you're going to do. So this thing, guys, I made up, right, is two softballs taped together. So it's like the peanut, but bigger. So what we're going to do is go after our external rotators of our hip. Okay, piriformis, obturator interns, externus, gemellus. Okay, and that's right in the butt. So you can take this thing and kind of just smash around. Okay, you can put this knee up. Any ball will work too, just a regular softball or lacrosse ball. And just work that out. Trying as much pressure as possible. Okay, so you're going to do that for a couple minutes. Next thing is you're going to take a lacrosse ball, okay? And we're going to go after something that we haven't done before. Your TFL, tensor fascia latte. It's like a Starbucks drink. So your TFL, this is your ASIS right here. Okay, it's laterally. Okay, so it's not your glute medius, which is here. It's right here. So it's right there. Okay, and this is an internal rotator of the hip. Okay, this thing is really tight. This directly connects to the IT band. It's actually the muscle that basically makes it work. So we're gonna loosen this thing up. So if we can loosen some internal rotators of the hip too, that'll create better external rotation. But we also need to go after those external rotators, which what we just did. So now we're going to go after the internal rotator, TFL right here. Take the ball and just basically go right here and just lay it right in there. This should feel pretty, almost kind of nervy. If it gets really tender for me. It's almost like you're hitting a nerve, that kind of pain, but you're not. It's just, this thing is really tight. And this will help with IT band pain if you are dealing with that. Okay? So this is a really good one. You need a smaller ball for this. And just contract that back leg. Relax. And also, the TFL is also a what's that called? It's an inhibitor of the external rotators and the glute medius, or overactive, excuse me. So if your TFL is overactive, which it usually is, our glute medius, all those muscles get turned off, which are our abductors of our hip, and they also provide stability. So going after that TFL right there will help tremendously with hip stability, because we're turning the TFL off and kind of creating more active glute medius, etc. Okay, last exercise. So we went after the external rotators with this thing, and then we went after the TFL, which is right laterally to the ASIS, which is that point on your hip bone. Last exercise, we're gonna get a band, okay, connected to something, okay. You're gonna put that leg in there. If you guys can see that, I got the band on my upper hip, and basically you're just gonna get out as far as you can. You guys can see that. See the band right here, okay, and you're just gonna do a little hip distraction. Sorry about my shirt. Okay, so you're gonna do some external rotation. Okay. You guys can see it like this. The band. Okay. Internal rotation by driving that knee out. External, internal. And basically you're just gonna get as much pressure on your hip while the band is creating some distraction. Okay, so if you kind of do a retest of that, I have a lot more internal rotation. Look at that. Before I was like right here, now I'm here. So there you go, guys. That's internal rotation. See ya.